more people are turning up positive when they test, including Bucs coach Bruce Arians. More on him in a second. But good news is the CDC has cut the number of days that you have to stay at home in half. It's the same for Americans who are exposed to COVID as well. But those guidelines can get a little bit confusing. Our Malik Rankin is here to simplify them for you.
The CDC says it changed its guidelines because people with COVID-19 are the most infectious in the 2 days before and the 3 days after symptoms develop.
They still expect you to be infectious for 10 days because everything is still 10 days, right? Masking or quarantine a mask, isolate a mask. That whole length of time is still 10 days.
The amount of time you have to spend self-isolating after exposure has lessened, and it depends on your vaccination status.
If you're boosted, you don't have to quarantine, but you should wear a mask for 10 days and test to see if you're positive after 5 days. If you're unvaccinated or if you had your primary series more than 6 months ago, you're considered basically, in this category, you're considered basically unvaccinated.
Dr. Tang says the recommendation to continue wearing a mask post-exposure is because you may still be infectious.
At least having less restrictive guidelines may mean that people follow them.
I asked him if we know enough about the Omicron variant to understand how long we're contagious with it.
We do not. These are overly complicated guidelines, and it's not going to help.
Which is why he recommends erring on the side of caution when deciding to stay home or wear a mask.
Now, if you test positive for COVID-19, the recommendations are the same for everyone, regardless of your vaccination status. Stay home for 5 days. If you don't have symptoms, your isolation can end, and it's recommended you wear a mask for the following 5 days after that.